had to unmute there. Hi, Governor.
Hi.
So I just want to make sure I understand this correctly. So you said that anyone testing has to report their cases to the Department of Public Health.
Yep.
So in the case of Tyson and Storm Lake, did it notify the Iowa Department of Public Health when its plant hit that 10% threshold that Public Health recommended for businesses to report outbreaks? I mean, 555 employees is far beyond 10%. So why did it take so long to get that information out to the public?
So you have to remember that they can get tested in many different ways. Sometimes Test Iowa comes in and we work with the facility to do all of the testing. Sometimes the individuals can go to their own physicians and get tested, and the place of business isn't aware of that. Businesses also, and we're seeing more and more of this, and I appreciate this, they are doing their own testing. They're working with the private sector and bringing a company in to the facility and do the testing. When the testing is done, they are submitted to the Department of Public Health, and at that point, through the case investigation, they start to see where there is the connectivity tied to a specific business. They reach out to the business. At that point, they don't know the number of employees that the business has, and so through the contact investigation and through the partnership with the businesses, they're able to see where the criteria is at and if they meet the 10% threshold. If they do, at that time, then they are designated as an outbreak. So, it's the process, and sometimes it depends on where they test, the timing that those tests come through the state hygienic lab. Sometimes it's 2 days. At the beginning, it was 5 to 7 days when they used the national lab. So there are a lot of variables that goes into the information that is being collected at the Department of Public Health, and what are the individuals that are doing the case investigation are drawing, and then they go through and move the process from there.
2 more questions. Second to last, David Pitt.
Yes, thank you. Governor, so what you just outlined there has shown us, though, in counties where there are meatpacking plants, the severity of the spread is significant by the time, it's made public, which I think kind of makes it more difficult for people in those communities to kind of put up their guard and be more careful, because you are making it a personal responsibility issue here. So maybe we could talk about that. I mean, is there a better way? I mean, there's got to be a way to swoop in sooner so that these things don't spread out of control in a county or a community before we know about.
Yeah, so that's why we're providing the information that we are on the website, so Iowans can go in and kind of see the numbers and what it looks like. But you have to remember, David, and I said this to you yesterday, since about March 11th, we have been in substantial spread, which means that Iowans should practice the same requirements and take the same proactive measures that we've asked them to do from the very beginning. Nothing has changed. We know that social distancing works. Social distance, practice good hygiene, wash your hands often, isolate if you're sick, and which has been consistent and not changed the entire time and is still the recommendation. If you fall into that vulnerable population, it's about 20% of Iowans that are 65 and older and or have underlying conditions, then you should continue to stay home as much as possible. Limit your trips to essential trips when you go out. Be familiar with your surroundings. I would, if you can't practice social distancing, have a face covering handy. So none of that has changed. And I'm excited. We are going to continue as we learn more and as we enhance the website. We are going to continue to provide Iowans more and more information so that they will be educated and will have the information at hand to monitor what's happening with COVID-19 and the virus activity within our state. So the same measures apply, again, that we have been talking about since we entered into substantial spread, and we have said over and over, we have to learn to live with and manage the virus until or if a vaccine is discovered.